If you are familiar with medical practice, you may be familiar with the term Haldol and the acronym B52. So not the firefighting plane. B52 is well known in emergency psychiatry as is a mixture of different medications to help calm down and sedate an agitated, aggressive, or potentially violent patient. B52 is a concoction of 5 milligrams of Haldol, 2 milligrams of Ativan, and Benadryl of typically 25 or 50 milligrams, which helps with the side effects of Haldol and helps sedate the patient. This can all be administered in an injection form and can help to prevent violence from happening in an emergency setting, such as an emergency room or emergency psychiatric unit. Haldol is an antipsychotic medication, which is a bit older than a lot of the newer antipsychotic medications that are out, and we're not entirely sure how it works, but it's thought to block the dopamine D2 receptors. So this medication is not only helpful for agitation, but it can also be helpful for tics that can be found in Tourette syndrome. It can also be helpful to treat psychotic symptoms. Another uniqueness about this medication is it can not only be taken by an injection form, but it also can be taken by mouth or an oral formulation. There's also an intravenous formulation that can go through the veins. So there can be some concerning side effects with this medication. In particular, it can affect the heart and cause an abnormal electrical activity of the heart, which makes it more likely that a heart attack occurs. Also, this medication, because it blocks dopamine receptors, can block dopamine in the movement pathway, and that could be more likely that shakes, tremors, Parkinson's-like features can happen as a side effect of this medication. Parkinson-like features is more likely if someone takes this medication over a period of several years, but it is possible, and if that happens, it can be difficult at times for the movements to be resolved and get back to normal. Other side effects that can happen, especially in young males, like perhaps from the ages of 18 to 30, can it cause muscle contractions like dystonia, which can be very unpleasant. In fact, sometimes dystonia can affect the muscles that affect the breathing pathways, and it can make it hard to breathe. There are medications that can help address this, such as Cogentin, which can be taken by mouth or can given an injection, and that can help with the muscle contractions. So Haldol is not used as much these days because there are a lot of other antipsychotic medications that may have a similar function, but less likely of the side effects, in particular on the heart and with the movements. But another advantage that Haldol can potentially provide is that there is a long-acting injectable formulation, which you can take an injection once a month, and it's supposed to help with the aggression or psychosis. So that can be particularly helpful in people who suffer from like psychosis or schizophrenia, because oftentimes they don't see that they have a disease or that anything is wrong with them, and they're going to be unlikely to take a medication orally by mouth. So a long-acting injection may be more practical because it just would involve once a month visit to a pharmacy or nurse to administer the medication.